Welcome everybody back to our final session. We've had some really great discussions today. So this session is about the future role of patient organisations in health policy decision making. And we're going to reflect on what we've heard today. But before we do that, we're going to invite two very senior expert patient representatives who are involved in national and international patient organisations to help us reflect on the role of patient organisations. And so it's my pleasure to welcome Stanimir Hajida, who's Secretary General from the Patient Access Partnership, and he will pronounce his name correctly. And I apologise to all speakers for my terrible pronunciation. You know that's an English thing. But welcome, Stanimir. There's a... you can...
I can take any.
You can, yeah, if you just, yeah, perfect. And just press the green.
Okay, thank you very much, and thanks for inviting me to this conference. Now, I'll try to do something which is quite different from what we are used to do. Being patients, we have problems right here and right now, and very often we are focused on these problems, and there's a good reason for that. Sometimes we fight for our lives and for our well-being. But sometimes it's also good if we can look a bit further and start thinking, okay, if I resolve this problem now, where I want to be afterwards. So thinking of the future is something that we neglect a lot. And if I ask you right now, how do you see the role of patients and patient groups in 5 years? Probably many of you would have some vision or would have some improvements from the point of view of today, what needs to happen. But if I put the question about in 10 years, how do you see the healthcare system in your country? What kind of healthcare do you expect in 10 years' time? How about in 20 years' time and 30 years' time? These are questions that are very relevant to us. Most of you are going to live at least the next 20 and 30 years and even more, because the healthcare systems are improving and improving, and the life expectancy is increasing. So many of you are going to be alive in this period of time in 30 years. Have you really put some aims and some goals for your own healthcare systems and for you as people, where you want to be in this period? I know it's very difficult to predict what will happen. It's extremely difficult to predict how the science will evolve, how many new medicines we'll have. Maybe we will have a new way of treating people. Maybe we will have a new way of organizing our healthcare systems. And this is where I want to put the focus right now. So, does any of you have any insights on the future of healthcare? Are we going to have universal treatment? Well, as I said, it's difficult, but we know some trends that are most likely to happen. On first place, it's the digital revolution. Digitalization of healthcare systems is happening now, we can see it, and it will be huge. It's only the tip of the iceberg that we see. The real potential of digitalization has not been unlocked yet. We are still working on infrastructure, on doing and providing services, but we have not used the potential of the linked societies and the potential of analyzing this big data and using it in the best possible way to discover new medicines, to analyze the current ways we provide healthcare and to improve that. This would unlock huge potential. Also the communication between patients, doctors, patients from different countries, doctors from different countries on international level. And if we put on top of that, only I'm throwing some thoughts. If we put on top of that the development of the artificial intelligence and its role that it's gonna play play in our healthcare systems, you can see how complex and different scenarios we can take at a certain point in the next 10 to 30 years. The artificial intelligence is the basis of many technologies that we are already using in our hospitals. With or without our knowledge, this is the way that, for example, images are analyzed, and this is more and more used into the image scanning and the way that this whole specialty of doctors, rentgenologists, and other experts who up to now were the only source of knowledge, currently we have technology that sometimes is more precise than them in doing diagnosis. So can we expect in future that actually the role of the doctor will be replaced by technology? It's absolutely a realistic scenario, because currently, for example, we, as National Patients Organization in Bulgaria, we are involved into a project to develop the doctor's assistant of the future with 7 universities in Europe, and we are quite advanced. Soon we will have technology that will be capable to do screenings for you every single year. Why should you go to the doctor when the doctor doesn't have so much time to pay attention on you and to give you all the questions, if a technology can stay in every single home and ask you these questions automatically, so you can answer constantly on a regular basis? And why not this technology to be capable to do even some small diagnosis on some diseases that don't require even going to the doctor? All this is going to change the landscape. Are we ready? Is the question. And in my few slides, I'll try to outline some of the issues that we have to consider and to get prepared for these very, very exciting times that we live in. Actually, the healthcare has not been at such huge change, never in the history of humankind. This change that the digitalization is providing us and giving us the opportunity to have is huge, and we have to be prepared for this change. We can see it even today from the changing landscape for patient groups. The demand from patient groups is increasing. We constantly have more and more policymakers who are calling patients, please involve, come to our advisory boards and provide your expertise. At the same time, we have changing environment already in the classical patient groups. Until 5 years ago, we used to stay in an office, have a phone line, and we had all the patients calling us, meeting, complaining, and this is how we managed and maintained patient groups. Currently, we have many, many patient groups that are emerging regardless of the traditional patients' organizations. They emerge in the online space, they start talking to each other, they finally form kind of bigger groups. Some of them get formalized, some of them not. Some of them pretend to represent many patients, some of them not. So are we ready for this challenge yet, and how we address that? And did we do the transformation of the traditional patient organizations so they can address this obvious need and obvious space, which is the online space, and obviously our patients and potential members are there and they are demanding this information. The challenges continue. The patients' organizations need to follow the trends today. Do we have the tools, the knowledge to go into these online communities, for example? Do we have the tools and the knowledge how we engage with these new processes in the healthcare that are going to change the entire system and ecosystem? Are we ready? Do we understand what is artificial intelligence? And are we ready to get involved into that as well? So these questions are on our plate. Last but not least, the patients themselves. So the individuals, are they prepared to work with all these digital solutions? And how we make sure that the next generation is ready to work with all the iPhones, gadgets, and things that it's difficult for me to pronounce already, some of them, and they are evolving each day. Are our governments ready to that? And we see that governments usually would follow with years delays all these new trends. And unfortunately, or fortunately, technologies are evolving so fast that we don't have even months sometimes that technology is already changed. And if we continue providing policies in the old way with tenders, with delays and discussions, etc., most likely we are not going to be capable to answer on the demand of people and the current knowledge that evolves so fast. So all these challenges obviously need to find its solution. Hopefully in the debate we will have opportunity to talk about potential solutions, because I'm also keen to understand from the other stakeholders what they would recommend as a recipe. But up to now, at least the learnings that we have had in other spaces and other work is that we have to first listen, analyze data, and then based on that we have to plan good and train good in order to address all these issues. Hiding them and not talking about them doesn't prevent them from appearing and becoming our reality today. That's why patient groups need to transform, and we need to really move to the next level of development if we want to answer all this. How we do that, I really don't know. And this is a story that we have to write together. But if we don't think of this, we are never gonna start writing the new pages of the development of the patients' movement. With this, I hope I provoked you to think of that, and hopefully we will have the solutions in the discussion. Based on this discussion and based on everything that happened in the last days, and with the focus on the future, we will have a call to action launched as a result of this conference. For those of you who know who I am, I'm the guy who was calling my colleague to be ready for one night with the legislation. Besides being the National Patients Organization activist for years and chairperson there, I'm the Secretary General of the Patient Access Partnership, which is pan-European umbrella, getting together different stakeholders in healthcare. And there we definitely need to have this vision for the future. At the end of the year, based also from the feedback that we received from you in this conference, we will incorporate this in a European stakeholder consensus document that we call PACT to ACT. So it's a kind of actions that we will commit to do in the next 10, 20, I don't know how many years, but obviously things that we need to achieve if we want to improve our healthcare systems and improve our patient groups, doctors groups, and our house at the end, which we call Europe. Thank you very much, and really keen to listen to the debate with the others afterwards.
Thank you so much, Stanismir, for that, because we've been doing a lot of reflection up until this point, looking back at the 1978 WHO law. But actually, we need to look forward as well. We need to think about where healthcare is going to be. And the development is incredibly rapid at the moment. So we need to be prepared for that. So that was a great kind of reminder that we need to think about that, and a reminder that patient groups aren't doing this alone. This is being done in partnership, and we will pick up on that partnership element in the discussion. And Stanismir mentioned there that we want to create a sort of draft conclusions document from this meeting today. And with a number of the key experts, we sort of drafted the conclusions before we had the event, with the idea that our colleagues from EPF have really helped us with this, that they would present this, but we want in the discussion to think how we might want to modify what we've drafted. So I'm going to invite Radu Ganescu now, who's a board member of the European Patient Forum, to present that to us. Thank you, Radu.
Thank Thank you. Hello, everyone. And I'm glad to be here and to present these conclusions. And I think these conclusions are made it not by us, by APF, are made it by the patient organization, and by their experience they have in the activity they do in the national level or European level. The first conclusion, don't answer to Stanimir phone because it's possible to write a bill in the night. So our call to action, let's say, it's something that probably every one of us thinking or doing already. So it's nothing new. It's nothing that we find it yesterday. And I think it's important that this call of action is assumed by all of us, because it's a pathway that all of us should go, and alongside with the other stakeholder, alongside with the scientific community, with authorities, with government level, we should improve our quality of life. We should improve legislation, and we should improve the spare time of our life. Patient group involvement, we saw in the last days that there is different roads, different kind of involvement, and even the patient groups are legitimate as a stakeholder, essential stakeholder, because we bring the experience, we bring the experience of the patient from the grassroots, from there that not everyone can hear us or not everyone can see us what's happening. And this experience is something that cannot be shared by other stakeholders than only the patient and the patient or the carriers or the parents. And this is why we should be involved. And it's important that every patient organization have representative in different stakeholder institutions. And every institution, from the parliament, from the health ministry, in every country, they recognize the patient organization should send the patient impact. But sometimes they recognize it only by saying that, not by doing that. And this is why we need to push it more and see that even there is a variable input from patient organization, different state member, we need to have it the same input in every state member. We need to be equal and have equal input in the state level. We need to be present, and this is important as a patient organization, to be there where the legislation is writing, to be there where everything is decided for us. And I saw earlier today that everything for us, with us, not without us. So it's important to have this participation. There is some key principle emerging from this discussion, and I think everyone is agree with that. Political will, it's something that should be, let's say, the first decision. If they wanted to have the patient over there, they will do it, they will have it. So it's important to have this political will. Consultation and partnership, it's important to have partnership with different stakeholders, with industry, with science committee, with pharmaceutical committee, with public institution or private institution. Every stakeholder is important, and every stakeholder could give us some input or give us some, let's say, advice about how to do it and where to go in the future. Operational involvement, and of course, the last but not the last, the important funding and sustainability. It's probably the discussion that we have it since I don't know how many years, and probably we'll have it from here, but there is not a universal solution. There is different solution in different countries, in different member states, and we as a patient association, we try to adapt, and we try to increase our activity by finding solution in funding, and this is quite a difficult one. So it's important that we need to participate, and we need to involve the patient organization. So starting with the political will. So strengthening the public participation in national health policy design, implementation, evaluation. We saw some of the examples. So it's a possibility. Everyone can do it if it's wanted and if they have indeed patient advocate and patient representative that can be there and can do that. Key principle of solidarity, mutual trust, sustainability, empowerment, and accountability. I think these key principles are available for every member state, every patient organization. It's sometimes it's written, sometimes there is a legislation, sometimes there is a regulations, sometimes there are some, let's say, unspoken words, but everyone, it's clearly they need to have these key principles. Going further, it's about the consultation and partnership. It's, I think it's the consultation, patient organization, and appropriate channels and mechanisms for their meaningful and feasible participation. It's clear that when you want to improve something, you need to to have a consultation with every stakeholder. And the organization, the patient organization, even they don't have the expertise, even they don't have the right patient that have the abilities to discuss in some high level. Even with small words, even with small experience, can share things that probably none of us we can see it, or none of us can thinking that it's a possibility. And I saw that in different HTA, where a patient say that, okay, it's improving my health, but it's making my life miserable. So it's important that we have this input from the patient organization, even they don't have experience or patience. Operational involvement. There is different groups and different type of involvement. We discussed earlier about health impacting policy or social affairs. So sometimes health and social affairs are working hand in hand, and we have to go to both directions. Strategy of policy development, HTA, another, let's say, high-level discussion and very important. I will also bring clinical study here as a discussion, because clinical studies, especially in East European countries, are very important because they can have access for the patient in real time and also can bring a lot of financial resources for the doctors and for the hospitals. So it is something important. And of course, operational councils, sectoral committee working groups. Here it's a discussion about working groups and committee. Like I said yesterday, we are involved in different groups and different committee. But it's better to be involved and to have some action in that group, not to be involved just for the sake to be there and just to be a face in the group. So it's important, if you are involved or we are involved in some group, to have a voice in that group, to have indeed some impact, because you represent the patient community, and it's important that the patient community to understand that you represent them there, not just sitting there, but making for them a better life. So it's important how we represent in this committee or working groups. The discussion that we see it before, operational funding and helping for sustainability funding base. It's a long discussion, and I'm afraid we'll not resolve it if in this operational fund, the public funds will not be, let's say, involved for the patient organization. It's impossible to do patient advocate and to learn patient how to develop some skills if they don't have resources. And the resources for the moment, sometimes it's only from private. Until the public funds will not be available for patient organization, we'll have this debate many years from now. And I think we need to find a solution for each member state. And of course, promote truly participation, democratic involvement of patient organizations. So practically, this is the slide that, let's say, it's a call to action. This is the slide probably that we discussed since this morning, and we'll discuss it probably a couple of months from years from now. But I think everyone from this room can take some advice, can take some call to action, and maybe in one point or different points can go home and make it better for tomorrow. So thank you for that, and I hope that was clearly for you, like was clearly for me, and I think it's our common message. Thank you.
Thank you very much to Radu for that presentation. Just going to go back. That's it, sorry. That was a great presentation, Radu, of covering a range of issues that we've presented today. I will want to come back to that slide, so I'm going to ask the technicians if we can move back to the summary slide showing the principles. I don't know whether I can go backwards. Yep, that's it. We'll stick with that slide for the discussion, because I want to now invite our panelists and our speakers to come up and take the big chairs to join in the discussion. So do come forward now, and if we perhaps have, I don't know whether the Deputy Minister is always running in and out, so we'll give him the end spot. So, and Jakob, we know that you're busy today and may have to leave us. So I wonder if you want to start. You can see on the screen in front of you there some of the key messages that have been coming forward from the meeting today. What are your reflections about what we need to be doing next?
When I see the screen, I see the current situation here. Yeah. So I mean, what I feel, supposed to come, and what we really need to ensure, to find a way in the roles of patient organization. Okay, I mean, if the patient organization is involved also in the social area, then it's mean to be involved also in the discussion and the policies of Ministry of Social Welfare. In the countries like Czech Republic, when it is divided, of course, if you have a country which is such a luxury to have healthcare and social together, then it's a number of things are much easier. And again, we will probably also need to think about the body, which will ensure that, for example, the Ministry of Social Welfare here will be open to listen to patient groups, same as the Ministry of Health. All those things are coming together, and I believe once you will have a few member states who will allow that. Once you institutionalize the access of patients to that discussion, then those things could be easily transformed in the European Commission and in between the member states. So it's just to really work, with the case studies, which works well, to allow, those countries who have this good experience with patient groups, and I believe the majority of states will say yes, we have a very positive experience in that, to share this experience between countries, and then to also have this discussion on the DG level. And as I see quite a high hesitancy of a number of European institutions to talk to the industry, there's also quite a hesitancy to talk to patient organization. But once we have a member states who create this channel, this access, this needs to be transformed also on the European level. And I had a discussion with one of the key directors, it was the ECDC, doesn't matter, and I asked about the patient involvement in their policies, because there is a lot of things which are now discussed between the ministers. And here the answer and the feeling which I had from that is, okay, there are important patient umbrellas in the Brussels, But on the other hand, we even do not know what is it, what is the real umbrella, how many states should be involved, how the structure is supposed to be set up. So what the member states are doing now, that they are creating the definition for patient group. Again, this is the know-how which is supposed to be transferred on the European level, and to have a chance to also have the clear definition, and then through this clear definition, the clear access to the policy evaluation and discussion.
Thank you, Jakob. I think that's really important, because the last session we had about best practice examples from across Europe was really, I think, eye-opening to a number of us. People have been coming up to me saying, oh, that example from Bulgaria, that example from Scotland, what's happening in terms of the patient hub, I think you call it here, has created a lot of interest. So I can ask you this, in your role as presidency at the moment, just encouraging that sharing of information around how patient organizations are being involved is so important to ensure that we really do have effective consultation and participation processes at all levels of health service policy and design. And I'm going to move now, and I'll come back to you, Jakob, because I know you have to go, but to Edita Molorova, who's from NAPO, who's the board vice chairman. So Edita, you're very welcome. What are your reflections on what you've seen presented today?
Já bych chtěla...
If I may, I will speak in Czech. I would like to say that we have heard many things over and over again. It has been a surprise for me that practically everybody is concerned about funding and that we all speak about the definition. All of us present here know what we're doing. We know that our role is to do advocacy, to pursue advocacy, to advocate for patient rights. We need to speak to the individual stakeholders. We have to make it clear what our common visions are rather than the definitions, and stick to our goals and visions. Because if we speak about the definition of what a patient organization is to do, we won't do what we should be doing. This perhaps is the most important point from my side.
I'm going to ask Miroslava Forvinius from the Patient Rights Support Association in Slovakia for your views on what you see presented today and what's been discussed.
Thank you very much. Maybe a bit longer, not too much. But I would like to connect the main topic of this session, that is our future, with those principles. And I would like to present my view, what leads to these principles and what's behind these principles in terms of the future scenario. And I have to say that I'm so thankful and happy that I sit here on this, particularly this session, because I'm a big fan of science fiction. So I can see clearly that we are approaching to Star Trek, so it will happen, I know. But back, I would like to start from the other end. What if we want to come to those principles, like we can call them the conduct principles, we have to also have some principles how we behave or how we act. And I would like to emphasize 4 things: 2 betters, 2 more, and 1 less. First of all, we have to do better HR. We have to do better HR strategies within patient community to support more people who has very strong inner motivation, have hearts in this area, have courage, and can manage their fears. Because those people, this is a baseline for resilience, and those people can persist and continue their jobs and their work even in storms and crises. So that's the first better. The second better is better facilitation of dialogues at all levels, everywhere. also in designing, implementation, and evaluation of any activities, any activities, any projects, because that's important, you know, to do the right things in the right way, in the right time, with right people, and you know that theory. And some more, we have to do more activities related to common understanding of microsystems and microsystems, and also gaining more knowledge, for example, knowledge about the power of information and how the information transforms into data, and how data impacts our lives, everybody, our inhabitants of the countries. And we should do less activities alone. We shall have less solo riders on the national levels. I don't know how it's in your countries, but in my country, in Slovakia, we still see a lot of solo riders in patient organizations, and that's not effective. And if I can tell something what is behind these principles, if we can conduct them in a good way, then in, for example, 5 years term, I would like to see a system that is not allowing patients to fall into depression, fall into poverty, fall into loneliness. That's a short term. Then in 10 years time, for example, I would like to see the world that is integrating or merging those two big worlds, the world of the digital one and the world of the physical presence, right? And if I'm going back to Star Trek, I would like to see that we decrease our physical and mental vulnerability. It has already started with vaccination, for example, right? And the final thought is that I believe, and I wish for more adaptive tools that are very fast, that we can really, if some problem appears, we can be very, very and really quick to solve them. That's my view. Thank you.
Miroslava, thank you very much for those things we need to do better, things we need to do more of, things we need to do less, which is important to think about, and for taking us to Star Wars, and perhaps we all need to be Jedi. But before we go into general discussion, so start thinking about your questions, start typing them into the chat. We are delighted to welcome Ms. Katarina Konečka, who's a member of the European Parliament, who was due to be with us today, but unfortunately had to get back to Brussels. So we're delighted to welcome you, Katarina, from Brussels. Do give us your reflections on what you've heard in the session today.
Děkuju. Já předně doufám. Thank you very much. So I hope, well, I must say that if something doesn't work, it's usually the European Parliament. I'll speak in Czech because I'm very proud of the Czech POS. And I know we should speak about the future. If 10 years ago we asked the Czech POs what this will be like, they certainly wouldn't know that they would hold a conference, they wouldn't know about the legislation, about participating in these legal acts and so on. And in fact, these organizations won the battle. I must applaud them step by step. They have won. So to say what will happen in 10 years is science fiction. Many things will probably take place much faster than we expect now. And when I look back, I have been on the healthcare committee for 8 years. And 8 years ago, healthcare was like a Cinderella in the European Parliament. And after COVID, healthcare is very relevant. We discuss it very seriously. We discuss the role of healthcare professionals, pediatric medicine, pharmaceutical strategies, policies. But if someone said 8 years ago, this is what you would discuss, I wouldn't believe it. And I want to say hello to Stanislav. He has been doing a lot of it with me. So, some of these things used to be marginal. But I wish patients to really enjoy all these new benefits, and I hope we'll find a way how to fund it. Without funding, the professionalization of the organizations cannot happen. It cannot happen across Europe. Although we all exist in the online world, it's always better to meet face to face and exchange experience. And if funding is not there, then in many member states, if all these activities are just voluntary, we won't be able to move forward. So we know that NAPO in the Czech Republic organized another great conference. There were mostly women, it's mostly women in patient organizations, and they said, you cannot do this in your kitchen, all this work. So speaking about dreams, how we should exchange experience, that's what, from the European viewpoint, we can help to solve. But if things don't work in the member states, and if all this doesn't move to a more professional level, European solution will not help. So not in 10 years, but very soon, both in Czech Republic and other member states, we can find quite a very good and robust funding to make these organizations professional. And it's up to us in the European Union that things are interconnected. I presented many amendments for HTA and other, or amendment of DCM, and there is the pharma strategy. It's an incredibly complicated document. Also pediatric medicine, etc. So that's where we as MPs will need you, patient organizations. It should also be about the assistance from member states, so that there is more funding. At the moment, it's the national budgets, but you should really be helped to become real professionals. So that's my vision and my wish.
Thank you very much, Katerina. They're outlining the kind of range of policies that you're having to be involved in the Commission and the Parliament, and how you're relying on hearing from patient organisations what the impact of those is going to be. I'm now going to invite Robert to the stand, and he's going to take over the discussion with the panel at this stage.
Děkuji, Karen. Já bych si dovolil ještě než začne.
Thank you, Karen. Before the last discussion, I'd like to invite you to the Mentimeter to have the last vote. So let's look at the application. Let's look at the codes. So, the question we are asking, what do patient organizations need most to be more involved in health policy making?
tak zatímco pokračuje hlasování, tak já...
So, the voting is still going on, and it seems that two topics seem of key importance. So let me start with the second most important, the political will. What can we do as POs so that the state administration really shows the political will? Is there something that we as patients can also do to co-create this political will? It's always about a specific moment after the elections. We can set up the system so that it's not affected politically. And that's why we created a department and the ministry in the organizational structure. So, to do these things continually, if there is a government that is open to POs be involved in the debate and co-creating a legislative background, it's important. So the process must be formalized, although it may seem as too complicated at first, but then you can see that at the moment when the political will is not strong enough, this will defend the patient's interest, and the patient segment will be then involved in the legislation. So we should formalize the process, although it sounds terrible, and it must be involved in the key materials, the ministerial structure. The word or term definition of a patient organization may irritate you, but that will help if the political will is lacking. The same goes for European legislation. The political will must use this momentum, and then what will happen in the long term to, in fact, maintain the participation of patients in case the voice of the patients would not be heard. Patients must remain. So the Ministry of Health tries to protect its experts against political influences. So when we build patients' involvement, it must be preserved. And then, of course, the funding we discussed at the conference in Prague, unrestricted funding, that was the topic. But unrestricted is not suitable. It is money, it is operational, it's not funding for specific projects. On the other hand, we must also accept the fact that the money will always be linked to a performance, working performance. We cannot believe in the so-called project money. There are goals and objectives that must be met, and the funding is connected with it. So the so-called unrestricted funding must also be linked to some content. So I think at first the idea was a bit naive that the state would give funding and each patient organization would have a professional. That's impossible, and the same goes for all European member states. There must be some specific activity, so we just cannot avoid it. That's what must happen in the Czech Republic, and the same should happen on the European level. It's also about the so-called project money, even in umbrella organizations. this is ahead of us. This will be quite an unpleasant process, but once we manage to break through, it will be much easier to expand this part. So this is, in fact, a rather personal viewpoint than an official ministerial one. I'll now ask the international panelists to comment or say a few words about it. Now, after the vote, political, unrestricted funding, which is important for patient organizations.
This is a really important question for all of us, and within the European Patients Forum we have this discussion. The Patient Access Partnership has its own challenges, and also wearing my national hat, it's even more challenging there. And but we have some good models in Europe that started long ago and proved to be working, and I think we have to look into these models. We have more and more member states that actually incorporate and delegate some of the services that the healthcare system should provide to patient groups. For example, screenings, patient support programs, things that patient groups are already doing. And payments are provisioned already in the healthcare systems, and in many of the cases there's nobody else who is willing to do these services and provide these services to patients. So this is a source of funding that is underused and underestimated, but it could potentially provide a very, very important funding for the activities of patient groups that they do in any case, but in more structured way, more transparent way, and a way that can work better for patients. So such examples might be taken for different sources of funding. It's not necessary to be the ministry per se. It could be other sources of funding. The more core issue is what is the principle behind the funding. Is it money just for the sake of the money, or is it money that provide and bring add value to the healthcare system and the way the healthcare system is developing? Couldn't agree more on the performance indicators and clearly demonstrating the value of patients' involvement. So this is, I think, the conversation we have to have, very honest, how we measure this value. And what is really patients' value when we participate. This is also something that we as patients community have to be clear internally and then also discuss it and demonstrate it to the outside world. I couldn't agree. Somebody mentioned that we need to provide more evidences on this cooperation and this involvement. What does it really bring to the table of the policymakers? Actually, nobody is questioning what do the doctors add to the debate with the healthcare system and the Ministry of Health. Everyone is asking what do the patients add to that, which is not very logical way of putting the things in front. But I think we have to go through this phase. Many countries in Europe has gone. I see now your country is taking this road finally, and hopefully very fast you will go through that. But it's clear. Nothing for patients without patients, and the good politicians are those who acknowledge the huge potential of this cooperation for being better politicians and providing better services to the public at the end.
Thank you. Radu?
I want just to complete what Stanimir said. I was going to say not unrestricted fund, diversity of the funding. Because diversity of the funding show you that you're not an organization that depends only by the public or by the private or by the, I don't know what foundation or institution. You can have diversity of the funding, and you can offer, we discussed this today, is about patient advocate and patient organization with experience, but a lot of what we started as a patient organization, we started to provide services for our community. So practically this was the main activity for us, to help the patient, to find the doctor, to go to the doctor, to access the services, to even the transportation. It's a problem in some region, in countries. So we can go and look for the diversity of the funding in a lot of direction. So when I go to my Ministry of Health and I say that I have fund from private, I have from European funds, I have from APF, I have from or other institution, he will answer to me that, okay, this means that you're not depending by one or the other, and you can provide me your experience. So this is important. What I want to say is the political will. In my country, not always was the political will. This doesn't mean that we didn't do our job great and we didn't perfect our skills in order that the political will to see that they need to change the view and to be indeed open to patient organization, because they will be willing to collaborate and work with the patient organization after they see that the patient organization is very stable financially, is very credibility, has transparency, and indeed involved in the community and for the patient community. So you can change the political will by doing your activity that you're supposed to do, and doing better and better and better. And that's why you develop skills, and that's why you will change the political will in the future. So everything is integrated, and of course, it needs a champion, if you ask me, because you can do that. You can be deliver a patient organization work with 7 people and all 7 to say different things. We need one person to have the same direction and to be the engine for that organization, because otherwise the health ministry or any institution, public institution, will not discuss with 40 organizations, will discuss only with 1. So that's why you need a champion to do that.
Děkuju. Já se teď obrátím do obecenstva, ať už on-site nebo online. Chtěl by někdo...
Thank you very much. And now let me ask you here in the hall and in online space if you'd like to have any questions or perhaps comment the discussions that have been going on, how to ensure political support, what POs can do so that the counterparty is more ready for the upcoming cooperation. Any input or any questions?
Agree more with all my colleagues and also with Mr. Deputy Minister that what we need is a political system, healthcare system, and it is all connected. It's one circle. Maybe we have to find the leverage point, which could be the combination of the funding with the skills and education. To more grab our power, and I think that we don't use our power in all its potential, because we're not only patients, we are also inhabitants and citizens, and we have also other rights to be in councils and to be active part of the political life. We do not use this power, and that could be the leverage points.
Děkuji za připomínku, názor.
Thank you very much for this comment, for sharing your opinion. I wonder if the MEP is still online. I'd like to ask Kateřina what patient organizations can expect from European politicians. So health is in the competence of individual member states. However, you've mentioned that a lot is going on at European level. My apologies, but the only mic that I don't hear is the one that you're using right now. Let me try the other mic. I heard both ladies and gentlemen, but not you. Can you hear me now? Is it better? Can you hear me? No? Let me try third microphone, if that one works. And MEP Kateřina Konečná can hear us.
Můžou technici pomoct?
I wonder if the technicians can help us with that.
Musíme se vrátit k vám zpátky.
Well, let's go back. When the deputy minister speaking, one thing came to my mind. It was mentioned a couple of times that POs are equal partners. We shouldn't be pushing towards closed doors. We are part of the healthcare system, just as manufacturers are, pharmacies, payers, etc., other stakeholders. So there are multiple entities, institutions, the state naturally addresses how they operate, etc. And we are also part of the system. The patient is then the end user of the outputs, and perhaps some of the arguments raised here shouldn't be raised to, as Derek said, don't discuss the ROI, but rather look at it through the optics of a theory of change. But we shouldn't be providing the justification why we're here. Well, nobody questions and challenges why doctors are there. It's exactly the same. So should we actually continue to provide this evidence and measure something, our added value, etc., some complicated indicators or whatever? Or do we look at it from a completely different perspective? So should our position be the same as that of the other stakeholders because nobody questions their role in the system? Should we be one of them rather? Would anybody like to respond or comment, perhaps? Yes, MEP Kateřina Konečná. Thank you very much, and my apologies for the technical gaps. I just wanted to respond to the previous statement. Or rather, you have to be extremely cautious. I experienced this during the negotiations. It's nice to say that there have to be diverse sources of funding, but I was present when some fellow MEP said that at a time when patient organizations were paid by pharmaceutical companies, even like project funding, they were telling me that you have been subject to their lobbying and all that. So it's always very sensitive. And well, in HDA, we have found a mechanism that we'll strive to push through going forward as well. But it's very dangerous because if somebody doesn't have the will, they can always use that as a counter-argument. So I'm very well aware of the funding issue, and actually funding is lacking pretty much everywhere these days. But I shall do what I can to make sure that you're actually among the NGOs that can actually fit in a certain network or basket and can have some certainty of funding. It could be possible in some countries, but at European level, from the European Commission and from some colleagues of ours, we unfortunately are facing this potential issue of conflict of interest. So really we need to be cautious, because I wouldn't like to undergo these debates once again. I already experienced that like 3 years ago. So it should be a system that's well set up. So if you meet something as PO, you shall qualify for certain funding. There shall be a certain budget available. Well, not for completely everyone, because that's not possible in healthcare. Naturally, it can't be unlimited, because whatever money is spent in healthcare, that will be spent. But I'm very much in favor of the umbrella organization. I'm very happy that you've teamed up in that way for negotiations at European level. This is highly positive. It's much better than if, say, 40 organizations approach us at the same time. Thank you very much for these remarks. And perhaps one last question to the panelists. We are drawing to the close of our conference, so there'll be one final voting will be asking you about what you'll take away from the conference. But I would like to ask you exactly that question, and you can speak in greater detail. So what's your takeaway message from the conference, and what have you found most interesting here? Please.
Take away home the Czech experience, because what you started here is something that I never saw in other places, and maybe I can do that in my country and double it and make it working over there, because it was a discussion here. I think there is necessary, and the hub is something that it's wonderful if you ask me, and I think we need every day by day to learn new skill for the patient organization, to empower them, to make them to adapt to their countries. Yes, we prepare at European level, EU Party, or the summer school and other interesting events that can bring the knowledge and know-how, but in the end of the day, they have to adapt to the national level, they have to adapt to the legislation, and sometimes I think this sharing experience that we have in, at least in Central East European country, can make us to be better in the way that we do it as a patient organization.
The need. It's the need normally that makes us so active in these countries sometimes, and the huge differences that we have. But my message, of course, I'm probably going to look into the future, and also the transnational work that we do also with MEP Konečná, which she's very, very active, a member of and co-chair of the interest group on access in Brussels, and throughout the years she has been championing many of our initiatives. But my takeaway message here is we can do more. For sure we can do more, regardless of what we have done. And I would encourage everyone not to give up, but to do more. Because the future is challenging. The future is actually coming now. And if we don't do more, or if we stop doing, we risk a lot. So regardless what we have achieved, we want and we should demand more and more and more for the better of all of us and our societies. I'm sure we will sooner or later get to the point where we will have the perfect healthcare system, Chimera. No, it's not going to happen. A good system should be open to evolution and to adapt and change if needed every night, every day, based on the needs of patients. That's the best system, the one that is capable to change very fast and adapt.
Thank you.
I totally agree once again. What is my keyword that I'm taking home is diversity, and I wish that we create a safe space to experiment in the systems and have safe space to fail sometimes, to not blame everybody, but to do it together, with also on national levels, and to adapt and to change and again and again.
Thank you.
Přemýšlím, co říct, protože mi předřečníci v podstatě...
I'm thinking about what to say because the previous speakers have said it all, but let me perhaps repeat myself. My takeaway message is that we have to speak to one another. We need to speak to politicians. We need to speak to researchers, doctors, to one another mutually, and seek consensus, seek our common goal, and near that common goal, because unless we have a target or several targets, we won't be able to measure our success, not just us as patients and patient organizations, but politicians too, because unless these common goals are defined, there won't be anything to measure. So much from my side. Thank you very much. And MEP Konečná, would you like to share your personal takeaway message from the conference? It's a working message. I'm sure that together with Stanimir and other wonderful colleagues, we'll need to sit down and the really it's the time to act, and we shouldn't just keep it to ourselves, those of us present at the conference, but share it with others, because surely there is a lot of reflections to be done in the legislation that we'll discuss in the Parliament before the end of the term of office. There are many pieces of legislation that still need to be debated, and we indeed keep the dialogue, but the meaningful involvement of POs, etc. So all that should go hand in hand with the new legislation currently in the pipeline in the European Parliament that will come into force and effect in 10 years' time. We shouldn't forget patients at any time, but that's not just my role, but the role of all my colleagues who are involved in this, in the interest group long term. So for my part, I can say that we should get this call of action to a broader audience and get it to the European Parliament. We'll think the way through and let you know, keep you posted. Thank you very much. Thanks to all the panelists for their fantastic inputs and great food for thought once again.
So, at this moment, we'll have the last vote. Please do participate. Again, we'll use the Mentimeter. Let's try it. And it should be one word. What is your one word conference takeaway? So, before you write your answers, Karen might share her takeaway.
Well, I think I'm lucky because I'm not just going to use one word. I'm going to reflect on what I've heard during the day. And I think the first thing to state that we all agree on is that involving patient organizations effectively can improve the efficiency and quality of healthcare and patient outcomes. And this can lead to health system sustainability. And we need to explain that to decision makers. But that the way in which we involve patient organizations depends on culture and context. So we can learn from one another, but we need to understand our own culture, context, and history. And then I think we need a framework for patient and public's engagement. And that needs to think about what level of participation we need, patient organization, publics, how that engagement should happen. It's not just about interviewing one patient or asking patients to fill in a form. There are many different ways in which we can enact participation. We need to think about those. I think then we need to encourage patient organizations to be representative and show that they are presenting the diversity of patient views. So one of the things we haven't talked about so much today is about credibility, but actually that relates to mutual trust, which is one of the things that Radu says. And so we need to equip patient organizations to be able to gather the diversity of all patients' views to input to policy making, and then that is seen as credible. Then we need to help patient organizations with their sustainability. This financing issue that's just come up, and for those online, you will have seen that the Portuguese colleagues have pointed us to an element in their charter that talks about funding, so we'll share that with you. But I would say that to you as patient organizations, you need to think about your impact, not to demonstrate your worth to decision makers, but to think about what it is you want to do, because you are being asked to do a lot. And you actually need, I think, as both Stanimir and Radu said, you need to think about where healthcare is going, where your key goals are, because you have limited resources as well. So you need to hone your own ambitions to go in the direction which is going to have most impact. And you might start saying to decision makers, I'm not going to come onto that committee unless you can show me that I'm going to make impact, but that's me being a bit controversial. Then I think what we need is that safe spaces for dialogue. Dialogue, 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 so that we can all share what our challenges are, because we all have challenges, but we all have experience and knowledge which we can give to one another. And that's what builds trust, builds credibility, and develops relationships and mutual trust. So that's what I took from the day, Robert. Let's see what everybody else said.
Thank you very much, Karen. Já jsem rád, že se nám v tom takeaway, v tom word cloudu
I'm happy that in the takeaway we have words such as hope, both in Czech and English. So that's very positive. And with this hope, I'd like to conclude today's conference, and I hope that similar meetings will continue. It will be a rule that patient organizations will have the opportunity to meet, to discuss their topics. That's one of the hopes that I'll take away from this meeting. And I hope that in time, and it's no science fiction, patient organizations will be a part of the healthcare system, will not be someone outside, will have the same rights and obligations as the other actors in the system. Also, during the conference, we heard that patients involved, it's not just an added value, it's a key value that should be in the system. So we should be a part of all that. And there have been many comments about the rules, for example, the gunning principle, which has shown that we are not just those who should ask, we should not just be asked about our opinion, we should be involved in all the processes from the beginning. Also, the involvement of POs differs across Europe. There is not one template, one solution. So I'm happy we have agreed with the EPF that from today's meeting we'll take away not just some experiences, impressions, but a document that we'll process together with the EPF members, we'll sign it, and we'll take it to our national governments where we'll reopen these topics. I'm glad we have the champions at the ministry. The dialogue exists. We have representations at the ministry. Politicians listen to us, but we'll have to do more. So the conclusions, you'll find them on our website, on the EPF website, and by the end of the presidency, we hope the conclusions will be in the official presidency conclusions, and they'll be presented to the European MPs, and we hope that Sweden, the next presidency country, will take over from us. I'm happy that this conference has really met my expectations. I've heard a long list of ideas. I am happy I don't have to be hosting the conference, chairing it. I'm happy I could listen and write or put down notes, so that was important for me. I would like to thank Karen for her excellent work today. Karen, we are so grateful to you. Thank you very much for being with us. And of course, now it's like at an award ceremony. I want to thank all the organizers, partners, sponsors. I must thank all the presenters. Of course, this was not paid for, and also they had to take time off to attend. The team of NAPO, Bohdana, Eva, and others. I would like to thank you for your interest. We have had participants from 22 countries. I hope our messages could be heard in other countries too. I'd like to thank the national ministries of health who will discuss our call for action, and we'll try to convince them we are one of the pillars of healthcare. I would like to thank all of you. Well, that means to thank us, patient organizations, because your enthusiasm, our enthusiasm, and also doing it in your free time, voluntary work, it's not always appreciated sufficiently. Thank you very much, and I hope to see you soon.